Today, we'll have a short discussion about Agger, Haller cell, and Onodi cell. All are ethmoid cells. So, the ethmoid cells have a tendency to migrate into the adjacent bones, causing variable pneumatization. So, when the ethmoid cell migrate and pneumatize the lacrimal bone and the frontonasal process of the maxilla at the ethmoidal crest area, it is known as Agger. So the agar cell forms as a bulge above the attachment of middle terminate. That is, a bulge will be seen on the lateral wall of nose anterior to the attachment of the middle turbinate. So an agar forms the anterior wall of the frontal recess. So agar is considered as part of the frontal recess. So anterior wall of the frontal recess is formed by the anterior wall of agar. If there is an enlarged agar, there can be a blockage of the frontal recess and frontal sinus drainage. So a prominent agar can also displace the anterior attachment of the middle terminate posterior superiorly. Agar is known as nasal mount. So what are Haller cells? Haller cells are also part of the anterior ethmoid group of cells, but the ethmoid pneumatize into the roof of the maxillary sinus or the infraorbital area. It is also known as maxilloethmoidal cells or infraorbital cell located beneath the ethmoidal bulla. So an enlarged Haller cell can block the infundibulum posteriorly and block the drainage of the maxillary sinus. So, and also a mucocele can develop in a Haller cell. An enlarged infected Haller cell can even impinge to the infraorbital nerve, causing orofacial pain, numbness over the cheeks, etc. The next is the Onodi cell. Onodi cell is the posterior-most ethmoid cell. So the ethmoid is pneumatizing into the posterolateral part of the sphenoid bone, that is known as Onodi cell. The main significance is the optic nerve can run on the lateral wall of the Onodi cell. So we have to be careful while opening the sphenoid sinus in such cases. Also, it is closely related to the internal carotid artery. There are three types of Onodi cells. One is superior to the sphenoid. Type 2 is superolateral. Type 3 is lateral. So, three types of Onodi cells. What is the relationship of the optic nerve canal to the sphenoid sinus? So, there is a classification known as Delano's classification in which type 1, the optic nerve is found superolateral to the sphenoid sinus. That is the most common finding. The optic nerve is superolateral to the sphenoid sinus and it passes without any indentation or impression on the sphenoid sinus. Type 2 is the optic nerve causes an impression on the sphenoid sinus. Type 3 is the optic nerve passes through the sphenoid sinus. Type 4 is the optic nerve is passing lateral to the sphenoid and sinus. This condition especially occurs when there is a Onodi cell. Optic nerve can be seen just on the lateral wall of the Onodi cell. This is the radiologic classification, coronal cuts of the CT scan. Some classifications say optic nerve is making a less than 50% indentation, is type 2. If it is making a more than 50% indentation, it is type 3. So agar nasal mount, anterior-most ethmoid cell anterior to the attachment of the middle turbinate into the lateral wall of nose. Haller cell is maxilloethmoid cells. It is also part of the anterior ethmoidal cell system. Onodi cell, ethmoid cell, Onodi optic nerve. O, that is a significance. It is posterior-most ethmoid cell.